बिस्मिल्लाहिर्रहमानिर्रहीम। आज हम इंशाल्लाह पढ़ेंगे लोकल एनेस्थीसिया। तो डिफ़ाइन करते हैं लोकल एनेस्थीसिया। व्हाट इज़ लोकल एनेस्थीसिया? दिस इज़ इंजेक्शन ऑफ local anesthetic agents, injection of local anesthetic agents, anesthetics agents to any surgical surface just to block pain sensation. यानी जो सर्जिकल एरिया होता है इससे पहले हम उसी साइड पे इंजेक्शंस देते हैं लोकल एनेस्थीसिया का, सही है, ताकि जो पेन है वो ब्लॉक हो जाए। तो दिस इज़ कॉल्ड लोकल एनेस्थीसिया। अब इसके डिफरेंट टाइप्स है लोकल एनेस्थीसिया के। तो सबसे फर्स्ट वन जो है वो है टॉपिकल एनेस्थीसिया। टॉपिकल एनेस्थीसिया इज़ अ टाइप ऑफ एनेस्थीसिया विच इज़ अप्लाइड ऑन द स्किन इन क्रीम फॉर्म or which is applied on the surface in cream form. So we will write in cream form on surface for what? To block pain sensation. The second one is local infiltration. The second one, local anesthetic, is local infiltration. Local infiltration is actually anesthesia which is given before the stitches. यानी टांकी लगाने से पहले जो हम एनेस्थीसिया देते हैं पेशेंट को सबक्यूटेनियस टिश्यूज़ में, इसको हम कहते हैं लोकल इन्फिल्ट्रेशन, एंड इट इज़ ऑन द subcutaneous tissues. थर्ड वन टाइप जो है वो है रीजनल एनेस्थीसिया. Regional anesthesia is actually a type of anesthesia in which the whole region get blocked. Whole region get a block. Like it has different types. We can say neuroaxial blocks and peripheral nerves block. Two types of regional anesthesia. One is called neuroaxial blocks, and second one is peripheral nerves block. Now the neuroaxial blocks has further two types. One is called spinal anesthesia, and second one is called epidural anesthesia. Now we will study different types of anesthetic agents like lignocaine, bupivacaine, etc. So the first one anesthetic agent is lignocaine, which is the most commonly used local anesthetic agent. Lignocaine, this is actually doses 3 mg per kilogram of the patient body weight, 3 mg per kg. And always remember about the lignocaine that it has less toxicity and plus less side effects. That's why it's commonly used local anesthetic agent. Always remember one point with this: if you are using this lignocaine, like local anesthetics, if you are using this with adrenaline, you will always increase the dose. With adrenaline, you will increase the dose from 3 mg per kilogram to 7 mg per kilogram. So why adrenaline sometime given with the lignocaine? This is a question. So sometimes the local anesthetics get entry into the blood, which may have some toxic effects on the body. So some lignocaine enter the blood, which leads to blood toxicity, and it has different toxic effect on the body. So we are using lignocaine with adrenaline. The purpose of adrenaline main function is it causes vasoconstriction. When the vessels become constricted, so the entry or the systemic absorption of lignocaine decrease into the blood. This is the main reason. The entry of lignocaine to blood decrease. That's why we are using lignocaine with adrenaline, just to prevent the entry of the lignocaine to the blood. Because if the lignocaine enter into the blood, it may have some toxic effect on the blood, and the blood obviously will go to the brain, to the kidney, to the liver, and it has consequences. So this is the first reason, it causes vasoconstriction. The second one is due to adrenaline use. As we have already studied that adrenaline causes vasoconstriction. So the advantage is it provides a bloodless field. It provides a bloodless field during surgery. Like let's suppose if someone is going through nasal surgery, septoplasty. which is septoplasty. If someone is going through septoplasty, then we are using local anesthetic lignocaine in combination with adrenaline. The third one is adrenaline is used in combination with lignocaine, but always remember, do not use lignocaine plus adrenaline in area where there is end arteries. Don't use in a area where there is end arteries. Like, let's suppose if you are using this in combination with adrenaline, where there is end arteries, then you can cause the necrosis and even ischemia and even gangrenes of that area. Let's suppose you are using it in finger region. If you block this arterial supply or blood to the finger, if you are using lignocaine in combination with adrenaline in this area, this is the end artery. This artery supplying the rest part of the finger. Then you just block the whole blood supply to that area. So there is a chance that necrosis or ischemia of that area may develop. So never use lignocaine with the adrenaline, particularly in area where there is end arteries. The fourth one is, do not use lignocaine plus adrenaline combination in a patient who is already using antihypertensive. Patient who is already using hypertensive medicine. Who are using already hypertensive medicine, because hypertensive medicine, it causes vasoconstriction. You can't use the lignocaine in combination with adrenaline because it will severe the vasoconstriction and it may block the complete blood supply to that area, and you can lead the organs or area into the necrosis and eventually ischemia and tissues death. So never use adrenaline in combination with lignocaine in patients who are already using hypertensive medicines, because hypertensive medicines patients, his vessels are already constricted. The second most commonly used local anesthetic is bupivacaine. This is, the dose is 2 mg per kg. The previous one was 3 mg per kg, and when you are using the previous one with adrenaline, then you have to increase the dose to 7 mg per kg. This one is the most potent one. But why we are not using this one? Because it can cause cardiotoxicity. That's why we are not using this commonly, and we are commonly use the lignocaine. The third one local anesthetic agent is prilocaine, and the dose is 6 mg per kilogram, and this is least cardiotoxic. But the disadvantage is it causes melt hemoglobinemia. Like we can say the hemoglobins become melt, and you remember that hemoglobin function is just to transfer oxygen. So you will reduce the oxygen carrying capacity of this patient, because you just melt all the hemoglobin through the use of prilocaine as a local anesthetic agent. The fourth one is ropivacaine. Dose is 3 to 4 mg per kilogram. And the last one is, these are least using local anesthetics. Levobupivacaine.